San Diego State was going to be an unusual school of public health. There were only two schools of public health at that point in time that were not in academic medical centers. And what I had to do was find a niche and be able to argue that, yes, we needed and should have a school in San Diego. So we could focus ourselves effectively on that mission of creating public health professionals for the state and working with the existing public health professionals to more effectively help them achieve their mission in terms of research, service, and education.
When I first came to San Diego in 1997, I knew it was a special place and meeting the faculty because of how they connected with students and how they connected in community.
As the first school of public health in San Diego, I think it's really, played a key role in training public health professionals, in really serving as the linchpin for the local public health community.
To think that San Diego School of Public Health has been part of the larger San Diego State University for 40 of its 120 plus years is incredible. It's the ability to not do research just at a local level, but to extend and do a lot of work in the international setting.
The SDSU School of Public Health uniquely addresses the needs of underserved populations in a number of different ways. But I think the one that really stands out for me, and that's been around since its inception 40 years ago, is the approach that faculty, and by extension the students that we attract, the way they look at the world. So they really look at it from an ecological perspective.
When I would work with the students from the School of Public Health, they were bright, they were eager, they were hardworking. You want to be able to select the talent that you want to see. And in some cases, I was fortunate to be able to eventually hire some of those students down the road.
San Diego State has been so instrumental in forging very strong community partnerships. The School of Public Health in particular is always keen on connecting with community providers such as SHARP and others and finding out what their priorities are. Their research is very linked to what we do on an everyday basis, and they really form that interplay between academic research and the practical pieces of healthcare operations.
The School of Public Health is a great community partner. And one of the things besides, the preparation and training of public health professionals is also the work that the school does with the Institute of Public Health. And I've had an opportunity over the past 7 years working side by side with the IPH on 2 projects. They were just really wonderful examples of how the school and its academic research unit benefited the community.
That's what really makes our Graduate School of Public Health extraordinary, is that connection of the academic insights and research and teaching and population health improvement. And when you then fast forward that to present day and what we've been dealing with the pandemic and saying, how can we help protect the public's health? That's just one of many examples of how the extraordinary work of a single faculty with our Public Health Institute and the research and our faculty rallied behind to respond to this great pandemic of COVID-19.
So I think the School of Public Health provides students with a holistic and interdisciplinary approach to the dynamic field of public health. There's various opportunities for internships, working with research faculty, grant writing opportunities that really equip students with the tools, resources, and knowledge that they need to excel in their public health careers and any specialization in the field of public health.
A lot of research is being done by SDSU looking at how people are doing from a behavioral health standpoint. Mental health has really taken a big hit. So using that information to help coach our patients or the people that we serve accordingly has been invaluable.
One of the things I'm excited about at San Diego State University and in the School of Public Health is San Diego State's commitment to bringing on additional faculty, all with a focus on Black populations, African American populations. This position that involves both a science around dissemination and implementation, as well as a focus on the African American community, is really going to help us advance the field of minority health and health disparities.
So it excites me that we've aligned our purpose and passion around health equity with a population health approach that now allows us to really drive and make those gains that we've always been moving towards and need to do for our San Diegans.
I think there's a strong collaborative presence of our faculty here at San Diego State that work with San Ysidro Health and other federally qualified health centers, and that is what is bringing the research into the community and making those long-lasting, impactful changes.
The students not only learn what's current in the industry, but we as executives get to learn a lot from them. They're very inquisitive, they're heavily involved in research, so they help inform our thinking. Many times, as a health system, we are trying to make sure that what we are working on is pertinent to current needs in the community. So the students bring that knowledge with them.
No matter how you define community, we want to work with those individuals who are most impacted by things that don't allow them to live healthy, happy, and productive lives.